So our next speaker is Ann Douglas, Director of Behavioral Health and Prevention Programs at All Nations Health Center. All right, and I'll stop sharing and take it away.
Well, thank you for inviting me. This has been really amazing to hear from everybody. Let me share my screen. All right. So just to introduce myself, my name is Ann Douglas. I'm a psychologist and director of behavioral health at All Nations Health Center. I'm also the director of the Native Connections program, which is a program, a SAMHSA-funded program for suicide prevention among Native youth ages 15 to 24. We are a FQHC, also an urban Indian health center. So we provide medical, dental, behavioral health, health promotions. So it was really great to hear from the last presenters to see what other urban Indian health centers are doing. It sounds like we're doing a lot of similar things, which is nice. But today I really wanted to talk about suicide prevention as kind of my area of expertise and what I do a lot with All Nations. So for Native American suicide rates, Native communities experience higher rates of suicide compared to all other races. And this is nationwide. Suicide is the second leading cause of death for our Native youth, which is pretty alarming. But I think living in the Native community, it's not surprising, which is sad. I guess, and backtracking on who I am. So I'm Blackfeet. I was born and raised in Browning, Montana on the Blackfeet Reservation, which is in northern Montana. We're right up next to the Canadian border, and Glacier National Park is my homeland. So living in that community, being part of the Native community, it's sadly, that it's sad that this isn't a big surprise. But this is nationwide, that suicide is one of the leading causes that we're losing our youth. And then overall, looking at the rates from the CDC, suicide has actually been declining for other races except Native youth. And that's pretty alarming that suicide prevention efforts have been working for other races, but not our Native youth. And I was also looking at some articles and found a national survey of drug use and health from SAMHSA. And this was pre-COVID information, but it looked at outpatient mental health services and inpatient. And Native Americans were third, reported being like the third race to utilize outpatient services the most, and actually the number one for inpatient. And so that, to me, as a psychologist, a mental health professional, is very concerning that from this survey, it looks like Native people are going to therapy, outpatient services, and then highly utilizing inpatient services. However, we still have the highest rate of suicide. So there's some disconnect there. And as a Native psychologist, I feel like it's my job to figure out what we're doing wrong and how we can help our Native people. So for specifically in Montana, where I'm located, again, backtracking, I'm sitting on the homelands of the Bitterroot Salish people. So I want to make sure that I acknowledge that. But for Montana has the third highest suicide rate in the nation. And we fluctuate between 2 to 5. We have a pretty high suicide rate throughout Montana. And then between 2009 and 2018, the highest rate of suicide in Montana is among our Native population. And the Native population constitutes only 6% of Montana. So that's another alarming statistic to think about. So we're losing a lot of our Native people to suicide, and specifically looking at the data from 2020, we lost our Native men. So our young men between the ages of 20 to 29, identified as general laborers, single, and the means of suicide were the use of guns. So it's concerning. And I think that it's something that everybody needs to be concerned about, because again, it's a form of like cleansing, like just getting rid of our population, and we're doing it ourselves. So I think it's something that we need to look at. So what I wanted to talk about today, I threw those stats out there, but we really focus on being resilient, and resilience, and Native people are resilient people. So taking a look at those stats and kind of working with my staff, I had everybody get certified in QPR, which is Question, Persuade, Refer. It's an evidence approach to suicide prevention. It was developed by a psychologist out of Spokane, Washington. And we took that and we indigenized it. So we looked at it and we thought, okay, so thinking about our Native youth, how can we get the message across of suicide prevention? How do we talk to youth about this and they're going to listen? So one thing we did is all of our presenters identify as Indigenous. I think it's really important for our Native youth to see Native people talking about suicide. And so we have that personal experience, the worldview, where we can relate to our Native youth and talk to them kind of from where they're coming from, using their language. So, you know, talking about aunties and uncles and knowing what that means, and using humor to talk about something that's very serious, because a lot of Native cultures, and again, I can't speak for all Native cultures, but something I see amongst a lot of Native cultures is that aspect of humor and how we can incorporate that into something that is serious. And then another thing we do is we help the non-Indigenous community to support Indigenous youth by helping them understand the worldview of our urban Native youth. So again, I just said this, but using Native worldviews, using the slang. So I put up reservation dogs because I don't know if you've seen this. If you haven't, I highly suggest watching this series. It's very relatable. I think I grew up on a reservation, and although I grew up in northern Montana, not Oklahoma, I still felt there was a lot of aspects of it that I could relate to, and I felt seen and heard, and I know my children did too when we watched this. But we use this in our QPR because a part of it, and I'll spoiler alert, that the fifth person in their group of youth dies by suicide. And so you don't know that till the end of the series, but we use that, we talk about it because it's so familiar in our Native communities on how this has happened and how it affects you throughout, because it's, again, studies, we are seen as other or something else. So when studies are done, we're just kind of lumped into something. And so looking at suicide statistics, people are 6 times more likely to die by suicide if they had a direct relative die by suicide. I hypothesize for the Native community that's even higher because of our lineage and relationship to people, that we don't go just by biology. And there was a great conversation before this started about that with the presenters. And so I would, again, hypothesize that that's, again, why our rates are so high, is because the research is not accounting for how we view relationships in our worldview. So yeah, so we use the reservation dog scene at the end. I think it's in episode 6 or something. And we talk through it. we talk about what's going on and like different ways people can intervene and ask the question, are you thinking about suicide? And kind of getting more comfortable and putting it in their own words. We explore different roles in the community. We really utilize like aunties and uncles. We try to utilize in an authentic way, because youth can definitely sense somebody who's not being genuine or authentic, but the youth slang. So talking about, you know, on different reservations, they have different slang, and that's okay to use. That's just part of who you are as a Native person. And so we try to bring that into the presentation to get people, to get the youth to buy in and listen. And so another effort that I wanted to talk about is increasing a sense of belonging. And to do this, we developed a suicide prevention campaign called I Belong. So really focusing on the sense of belonging, resilience, and authentic self, especially for our urban Native youth who might not have a strong connection to their tribal homelands or their culture, but just kind of showing up. And something that a Blackfeet elder had told me when I was kind of struggling through different like identity crises is that being Native, being Blackfeet isn't about, and he pointed to his skin, it's not about this, it's not about external, it's not about wearing ribbon skirts and, you know, braiding your hair or anything like that. It comes from here, it comes from your heart. And I've taken that with me throughout my whole life, and kind of something I want to give back to the youth, that you can show up, you can be a light-skinned Native person, that I am Blackfeet because I was born Blackfeet. I'm not Blackfeet because somebody gave me a card that says I'm enrolled Blackfeet, that I'm Blackfeet because it's internal, and that's who I am as a person. So that's what we're trying to do here with our suicide prevention campaign, is increase that sense of belonging. So focusing on the connection to land, the culture, and communities in general. So connection to culture, we serve probably 76 different tribes. I think that's the last statistic I looked at, people who identify from different tribes. So it's very hard in an urban area to just focus on one culture because there's so many. But we do encourage people to seek access to their culture, and we'll provide that if we have the means to do that. And one way we have tried to do that is through one of our programming called Soup and Stories. And we started this through the pandemic. It's a Zoom series where we provide all the ingredients to make a healthy traditional soup. Our dietitian will go live and make the soup, and kind of walk people through on how to make the soup. One of our mental health providers comes on and does a 5-minute like a meditation mindfulness activity. And then we invite an elder from one of the Montana tribes to come and tell a story. And again, along the lines of our I Belong, our series this season, this winter season, I guess it's over now, is that we wanted them to tell a story from their culture about belonging and acceptance. And we had really amazing turnout. Every one of our sessions, we had probably over 70 participants. It was really great. And that's something we try to focus on, is bringing that internal strength and resilience that just naturally come to Native people. And we do work really closely with our youth, and they made a film. It's 10 minutes long, so I wanted to show you the last end of it. And it's just how they feel that they belong and why they belong here in our urban community. I'm going to stop sharing and try to share that end of that video. Can you hear it, the panelists?
Yes, we can.
Yes, yes.
Thank you.
I've lived in two worlds, so to speak. Traditional co-Indian way, I dance, sing, and go to ceremonials and all those things. And at the same time, I live like a modern American. Gone to several colleges, had good jobs, but I can mix the two. Go to school, get a good education, and be able to compete in the white man's world and finding jobs and following a profession. You can blend the two and go a good bicultural way. That can be done. That would be my advice to these young kids.
When I look at the Native American youth today, I see a strong resiliency to thrive. I get to hear tons of aspirations for greatness. I hear goals, hope, but I sense a huge want for belonging here in the urban area. Our ancestors, culture, language, beliefs were here long before anything else. We do belong.
I feel like I belong because I'm a Native woman in a predominantly white community who speaks and fights for her rights and her ways. Proud of who I am and where I come from.
I feel like I belong because when people are down, I help talk to them.
Because this is my homeland. My family's been here for generations, and it's really nice.
I feel I belong because my people have fought for this land, and we have always been here, and we will continue to be here.
So I was really proud of our youth that put that together. It's actually 10 minutes long, and they talk about other aspects of being an urban Indian youth here in Missoula. But that is the end of my presentation, and if there's any questions, I'd be happy to answer them.
Nicole, do we have any in the Q&A?
Give me just a moment. We just have an announcement. Someone noted that on July 16th, the 988 will be activated as a telephone number for national suicide prevention. So maybe we should, as a Native community, make sure that our fellow Natives know about that as a resource. And I just want to say thank you so much for sharing. The video definitely, no matter where I've moved across the U.S. from coast to coast, I've found whether you're an urban Native, a country Native, a city Native, however you want to classify yourself, we struggle with the same issues. And while we are so different and we have our own set of unique cultures, we do share some of those same commonalities. And so, just being a youth myself, and I've heard so many times, learn the white man's education so you can go out and make a difference and bring it home to your community. And, hopefully, I've done that throughout the years, but I thank you for highlighting the suicide rates. It's not talked about in our communities enough, I don't think. And a lot of people just are living with shame. And like you said, we are resilient people, and we have to remember that we are resilient. And so we are worthy of being here and carrying on our traditions and our culture. All right. So we have a statement here. So One Dale wrote in, thank you, Anne, for bringing Blackfeet youth voices to the summit. And then another person asked if they can reach out to you directly.
Yeah, yes.
You maybe have a slide with your email address you can post up.
I don't.
Okay, that's fine.
But I could put it in the question and answer.
Yeah, if you can type it into Tracy,
do that.
that'd be great.
Are there other questions? I have a question. That's why I'm asking. It's
That's
burning.
all I see so far.
Burning. It's burning. All right. Anne, thank you. You're a psychiatrist or a psychologist?
Psychologist.
Psychologist. Thank you in your role as a psychologist for bringing this conversation. Nicole and I used to be part of ACES, American Indian Science and Engineering Society, and I think it is an incredible space that has changed a lot over the years. I remember going to conferences and seeing Native youth wear Indians caps and Redskins caps. And, you know, back then, before we had no big political conversation around mascots, it used to bother me. And I used to say to myself, and I think I told Nicole this a couple of times, it's almost as if like we as Native people know people don't see us and the only thing they see is our mascots, our caricatures. So we purposely wear those things, right? So that we're seeing, and it's kind of like this really interesting layering upon layering of colonial erasure, right? So my question for you is, actually, I want to give another example. And what I'm writing, one of the things I noticed in the Lumbee community, we'll come to a four-way stop, an intersection, and people won't drive because they're busy looking at each other. You know, we're busy like staring. And Nicole's laughing because she knows it's true. It impedes our driving because we want to look at each other. So maybe those two questions are sort of attached. What is it right now, this maybe the most important focus point of us as Native people speaking psychologically to the world? When we're not seen, when we try to make ourselves seen, and then when in moments where we're together, we just love one another. And we know that it's the only opportunity we have to see one another. So what do you say to that? Like, what is that one kernel message?
That's actually a
question. I apologize, but
that's okay. No, but I think just from working with individuals, individual Native people, families, groups, communities, I think we need to feel okay in our own skin. We need to feel like it is okay to show up as a Native person in all places. It's great to show up. Like, I love I'm so glad you guys invited me here, because even though I live in Montana and it's a pretty large Native population here, I love seeing Native people. And if I go down to the grocery store, by chance I'm not going to see a Native person, but when I walk in that store, when I see Native youth walk in that store, I want them to walk in as a Native youth and not put their head down and not shy away. But, hey, look at me, I'm Native and I'm here. This is my land, especially the Bitterroot Salish people who occupy this land before. But yeah, I think it has to come from an internal sense. And again, I think that's connected to suicide prevention. And we need to feel that we're worthy and we belong, and that being Native isn't about how you look, if you're dark enough, if you're light, if, you know, it's about internally who you come as a person. And it's a holistic approach. And so I think it's a really complicated question and there's no one right answer, but I think to start that conversation is to be comfortable being Native around non-Native people.
Powerful.
And showing up.
Yeah, that's
just
powerful.
Showing up as your Native self. And one thing I had one of my mentors, Dr. Patrick Weasel, had told me. I was an undergraduate at the time, and he said, show up. You're a Blackfeet from Browning. You walk into that classroom as a Blackfeet from Browning, your head held high. Where in like reservations, like in border towns, there's a lot of stigma about being Native or being from Browning, things like that. But he said, don't do that. Don't do that to yourself. You keep your head up high, you walk in there and you be proud and you bring that to non-Native people. And so I think that's what I think is needed around suicide prevention, is that sense of pride that we have when we come together in ceremony and powwow and summits like this, that sense of pride of being Native and being able to connect, bringing that into the non-Native community just as intensely.
And I think it speaks directly to how transformative our presence is. It's not only that we need to be proud of who we are. When we enter spaces in the United States, especially when we enter spaces as Native people, we transform the environment. It really is it's a 180, if you will, of whatever situation it is when we enter as Native people. So I appreciate you saying that. It's really empowering. Did Nicole, was there something else we needed to address? I don't know.
No, I just wanted to, echo, walking in with your head up and as that Native person, especially when you're not with your tribal community, sometimes that can be hard. And don't be afraid when someone approaches you and says, "You're the first Native I've ever met." I've gotten that so many times. And, I've had to learn not to be frustrated, but rather be open to educating. All right. So I'm going to send it to you, David, to introduce Dr. Pilson next. And thank you again, Anne, for joining us.
Thank you.
Thank you.